Most cats won't tell you when something's wrong. They won't limp dramatically. They won't cry out in pain. They won't come to you and say, "I don't feel well." Instead, they'll hide it. They'll change slowly, quietly, and hope you don't notice. And that's exactly what makes kidney disease in cats so tricky to catch. Kidney problems are incredibly common in cats, especially as they get older. But here's the good news. The earlier you spot the signs, the more you can do to manage the disease and keep your cat feeling better for longer. The key is knowing what to look for, and not brushing off small changes as just old age or quirky behavior. So, what should you be watching for? Let's walk through 3 of the most important, often missed warning signs that your cat might be dealing with kidney issues. These are signs that matter. They may seem subtle at first, but they can tell you a lot about what's happening inside your cat's body. And the first one? It's right in front of you, if you know where to look. Sign number 1. Increased thirst and urination. This is the number 1 early sign of kidney disease in cats. When the kidneys start to fail, they lose their ability to concentrate urine. That means your cat ends up peeing more, and to compensate for the fluid loss, they drink more. It's a vicious cycle. If you're refilling your cat's water bowl more often than usual, or you're noticing that it's suddenly empty by the end of the day when it used to last a couple of days, that's a red flag. Some cats will even start drinking from places they didn't before: the faucet, the toilet, the shower floor. If that's new behavior, don't ignore it. Now, let's talk litter box. Have you noticed larger clumps of urine? Maybe your cat is visiting the box more frequently, or they're staying in there longer than they used to. You might also notice accidents, especially with older cats. It's not because they've forgotten where the litter box is. It's because the urge to pee comes on quickly, and they may not be able to hold it. Many people write this off as aging, but it's often the kidneys working overtime and failing to keep up. It's the body's way of trying to flush out toxins that are building up because the kidneys can't filter them efficiently anymore. These changes in drinking and urination may not seem dramatic, but they're incredibly important. If you catch them early, you've got a window of time to intervene, before other, more serious symptoms begin. Now, let's move on to the second big warning sign, and this one is easy to overlook because it can sneak up on you slowly. Sign number 2. Decreased appetite and gradual weight loss. Cats can be finicky eaters. One day they love their food, the next day they turn their nose up at it. That's nothing new. But if your cat is skipping more than just a meal or two, if their appetite is noticeably smaller day after day, that's something you need to pay attention to. Kidney disease causes toxins to build up in the bloodstream. Those toxins affect the way your cat feels overall, including how they feel about food. Nausea becomes common. Even if the food smells fine to you, it might smell or taste strange to your cat. So they avoid it, or they take a few bites and walk away. This decrease in appetite leads directly to weight loss. And because it usually happens gradually, it's easy to miss, until one day you realize you can feel your cat's spine or hip bones more than you used to. The truth is, many cats with kidney issues will start to lose muscle mass well before they appear skinny. So keep an eye on their shape, not just the number on the scale. Even subtle weight loss matters. If you have a small cat who drops half a pound, that's a significant percentage of their body weight. Combine that with reduced energy, more sleeping, and maybe a little less grooming, and the pattern becomes clearer. You might also notice that your cat becomes pickier about textures, preferring wet food over dry, or even licking the gravy off their food and leaving the solids behind. That can sometimes be a sign of dental issues, but in many cases with kidney disease, it's simply about feeling queasy. And here's something that often accompanies this symptom: your cat might start hiding more. Not because they're angry or moody, but because they feel unwell. They don't want to play, they don't want to be touched, and they retreat to quiet corners of the house. That isolation is often their way of coping. So if your once hungry cat is now uninterested in meals, eating less, or losing weight slowly over time, don't assume it's just age. Especially if it's paired with the first sign, more drinking and peeing. Together, they tell a deeper story. Now, let's move on to the third sign, one that might not be as obvious, but definitely shouldn't be ignored. Sign number 3. Unusual breath or mouth odor. You may not think of breath as a clue to internal health, but in cats, it's surprisingly telling. When the kidneys fail to filter waste from the bloodstream, one of the things that builds up is a compound called urea. As urea accumulates, it can cause a condition known as uremic breath, where your cat's breath smells strongly of ammonia or something sour, metallic, or off. This isn't just bad breath from tartar or dental disease. It has a distinct sharpness to it, sometimes described as smelling like urine or bleach. If you're noticing that every time your cat yawns or grooms, their breath makes you flinch a little, it could be more than a dental issue. In more advanced cases of kidney disease, these toxins can also cause sores or ulcers in your cat's mouth, especially on the gums or tongue. That makes eating painful, which leads to even less food intake and starts a downward spiral of weight loss, weakness, and fatigue. If your cat is drooling more than usual, pawing at their mouth, or dropping food while eating, it's worth investigating. These mouth-related symptoms can be uncomfortable for your cat, but they're also a window into what's happening deeper inside their body. Now you might be thinking, what do I do if I notice any of these signs? The answer is simple. Get your cat checked out. Call your veterinarian and ask for a basic blood panel and urinalysis. These are standard, non-invasive tests that can give you clear answers about how your cat's kidneys are functioning. Even if the results come back normal, now you've got a baseline. And if there are early signs of kidney stress, you can take action right away, with changes to diet, hydration, or medications that slow the progression of the disease. There are prescription diets made specifically for cats with kidney issues. These diets are lower in protein and phosphorus, which reduces the workload on the kidneys and helps maintain a healthier balance in the blood. And many cats, once diagnosed and supported with proper nutrition, go on to live many more good years with stable health. In some cases, your vet might also recommend adding more fluids, either by switching to wet food or, for more serious cases, using subcutaneous fluids at home. This helps keep your cat hydrated and supports the kidneys in flushing out toxins more efficiently. And here's something else. If your cat is over the age of 7 or 8, it's a good idea to have a wellness checkup at least once a year that includes blood work, even if they seem perfectly healthy. Early kidney disease doesn't always show symptoms right away, but the earlier it's caught, the more you can do. It's easy to overlook the small stuff. Maybe your cat's drinking more, but they're still acting mostly normal. Maybe they're eating a little less, but they're still cuddling up with you at night. The signs don't always come all at once. But when you start connecting the dots, more water, bigger clumps in the litter box, less food, a little weight loss, a strange odor to the breath, that's when it's time to listen. Cats won't complain. They'll just adapt. They'll keep grooming. They'll keep pretending they're fine. But underneath the surface, they might be fighting something silent and slow. Your job is to notice. To pay attention to what's changed, even slightly. To trust your instincts, and to speak up for them when they can't. Because in the end, the signs are there. You just have to know how to see them. And once you do, you can give your cat a better chance, not just to survive kidney disease, but to live well with it. Thanks for watching. If this helped you understand your cat's behavior a little better, make sure to subscribe for more detailed, real-life advice for cat parents. No fluff, just facts, and the care your cat deserves.